Hey folks, I am Rebecca of Blonde in the Belly of the Beast. This is Robyn Riley, formerly Critical Condition, or currently Critical Condition, right?
I don't know. I think I'll always be Critical Condition to some degree.
And we have with us today Brendon Marotta. He is the director and filmmaker for American Circumcision. Thank you for joining us, Brendon.
Thanks for having me on.
Just to start, if you could tell us a little bit about how you came to be involved in this subject matter, what inspired you to make the documentary, and a little bit about the background of the documentary. I think that'd be a good place to start.
Sure. So the film American Circumcision is a feature-length documentary about the modern debate around circumcision and the growing movement that says that men should be able, and all human beings should be able, to make their own choices about their bodies. And the film explores both sides of the issue. It includes interviews with top experts on both sides. It includes a lot of personal stories. It includes a lot of science and statistics, and a lot of things that I think will move people and sort of expand the view of this issue. Because the way this issue is typically portrayed in American media is it's sort of this one-time decision that parents make and then never have to think about again. And in reality, it's something that affects a man for the rest of his life. And it affects his future partnerships and relationships. It affects his body and self-image, and it even affects larger cultural institutions. So the film explores all of that. And I think there was more to your question, but I totally blanked on what you asked.
Oh, it was kind of a beefy question. That's my bad. So what brought you, is this a personal issue for you, or were the men in your life? Like I have a lot of experience talking about circumcision online. People are very polarized about it. Yeah. But it started because I'm listening to the men in my life, like, you know, relatives and friends and people online just talk about how the realization of what had happened to them just shook them and rocked their world. And they're like, they just couldn't believe how normalized this was. So is that similar to your experience? So how did you come to be involved with the circumcision movement?
Yeah, this issue does affect people very deeply, and it affected me deeply. So I think, like most people, it wasn't something I thought a lot about. You know, when it came up, my feeling was sort of, well, there's nothing I can do about that now. So I think about it, you know, out of sight, out of mind. But in my early 20s, I was learning a lot about trauma and how things that happen to you early in life affect you later on. So I was reading things by Alice Miller, who's one of the first psychologists to suggest that. I was doing a lot of personal work on myself and shifting my beliefs and emotional patterns and relationship patterns and things like that. And I could change my beliefs and, you know, things like my diet and do things like self-development. But this was something I couldn't really change. And that bothered me because, you know, I think like most people, I want control in my own life and a sense of power. And this had a powerlessness to it. And I noticed that when I talk to a lot of people about the issue, there's sort of this reflexive, need to say like, well, I'm fine. Because, well, what would it mean if you weren't fine, right? Like, what could you actually do about it? And men especially are not allowed to be not okay, to show any kind of weakness or anything like that. So, you know, my attitude was, I think, very similar to most people, of like, I'm just going to not focus on it. But at the time, like I said, I was doing all this self-development work, and I had an experience during meditation, and the type of meditation I do is just sitting with whatever's in your body, right? There's no visualization or anything like that. But I had this thing during meditation where I had the word circumcision come into my mind, and I just felt this really uncomfortable, cold sensation in the body. And it was something that I later learned is not uncommon. It's what's known as somatic memory. It's when there's just a feeling stored in the body from early life that will come up later. And I figured after that experience, it was really strange. I hadn't had anything like it happen before, but I thought, you know, some part of my consciousness wants me to look at this, so I'll look at it. And some of the first things I found out were, one, just how traumatic it is. So the procedure is often performed and has been historically performed without anesthesia. So you can imagine someone cutting into a child, you know. And I'm aware that, by the way, I'm talking to two women who are in their pregnancy. So if anything I say is too upsetting, you know, I'm also aware that those chemicals and emotions sometimes affect the child. So if I start into something that's too much, let me know.
Oh no, it's okay. I
It's
mean,
okay.
this is something that people definitely need to hear about. And one of the things I really liked about your documentary was how some of the people that had it circumcised their own children back when it was just generally the thing that you did, how they were able to heal in some way by teaching other people that this is not something that's normal and it's not something that we should do. And I think that for people, especially that are really stricken with guilt, that did it when the doctors said, this is something you have to do, like rather than carry that guilt around for the rest of your life and just feel horrible, all we can really do is just continue to spread the message that this is not normal. This is totally barbaric. And then to try to undo a little bit of the cultural influence that circumcision has had on all of us.
Yeah, and I think as well, mothers more than anyone need to be made aware of the gruesomeness of this procedure and the reality of it, because as far as I know, it's a lot of the time mothers that are making this decision in hospital directly after giving birth to little boys, with very little actual awareness of what's going to be going on with their baby. So, I think the shock now is worth the prevention of a lifetime of guilt and suffering later on.
Yeah.
And the good news is that there are a lot of social issues that might require like these huge transformations of society. And this is one that just requires you to, not hold your baby down and rip part of it off. It's a much simpler, easier solution. And the other good piece too is, one of the things I found is that there are things you can do about it. So there's a whole community of men who are doing something called foreskin restoration, where they take this remaining skin and stretch it over time to create a covering there again. And it doesn't bring back everything. It doesn't bring back all the nerve endings. It doesn't bring back the specialized tissues. But that was also something that when I saw, I was like, well, wait a minute. I've always been told there's nothing you can do.
Right.
And there's also this perception too, that if you get into the issue and you actually allow yourself to feel your feelings about it, that, well, you're just going to feel bad all the time. And my experience has been the opposite, that it's the repression of the issue and a desire to avoid it or refuse to engage it that leads to the suffering, including the suffering of, it continuing and people still experiencing this as a thing that happens to their children.
Yeah, definitely. Yeah. I want to talk a little bit, if it's okay with you, about the reasons that there is such a visceral, such a polarized reaction. I've been called all sorts of things for talking about circumcision. They act like I'm some kind of like I'm in some kind of intactivist cult or something. Like it's madness, because the extreme behavior is the circumcision. But the argument that I hear the most, which I feel like is a real cope, is that it looks better, that this is something that's going to make your penis look better. It's something that women prefer. And I wanted to talk a little bit about that. I think it's such a stupid argument, because women are going to prefer what they are most accustomed to seeing. And if you're only seeing circumcised penises, then you're going to say that's your preference. So in America, if I understand properly, millennial men, I think 80 to 90% of them are circumcised, but in Europe, it's the exact opposite. And so I'm sure European women have a preference for an intact penis. So if you want to talk a little bit about the cultural norms surrounding circumcision and how that's influenced the preference, the visual preference. I know it's a weird question, but it is the argument that I hear the most in favor of circumcision.
There's a lot to unpack there, because even the statement contains so many assumptions.
Right.
So first of all, the circumcision rate now is around 50%.
Great. That's a lot better.
Polls put a little lower, some put it a little higher. But among the next generation, the norm won't be that everyone is circumcised, and it won't be that among anyone who travels outside of the United States, for sure. Mm-hmm. So I find that statement of well, women prefer it or it looks a certain way usually comes from people who are older and come from a generation where everyone was circumcised. So it's very much a boomer argument. It's well, people from people from my generation expect that. And it's but your kids aren't growing up in your generation. And also there's a really weird assumption that we would surgically carve up children for the sexual preferences of adults.
Yeah.
You might say that men prefer large breasts, but if someone said, well, that's why we should give, it made the argument that then you should give children fake breasts, you would think that person was really creepy.
Yeah.
And I think there's something equally creepy about wanting to cut little boys for the sexual preferences of adult women.
Right. I mean, even if you remove the element of sexual preference, it's totally bizarre to think that you would want to improve the look of a child without their consent as a baby. I think the whole thing is so weird. I kind of can't believe we've gotten here as a society. And something else that you talk about, or that it's talked about in your documentary, is female genital mutilation, which is I think it's aptly named, but the attitude surrounding it is so much more negative than male circumcision. Like we talk about male circumcision, we talk about female genital mutilation, and it is true that a lot of the clitoris is removed. But hearing that perspective from, I think it was a Somali woman that was in the documentary,
Yeah,
and how she the stuff that she was saying about female genital mutilation is exactly the stuff I hear from men that are circumcised that aren't unhappy that they're circumcised. They're like, it's a cleanliness issue. The appearance is better. It was strikingly similar. And so I'm just listening to this and I'm like, I can't believe that I'm getting to this place where I'm like, well, if we're going to allow male circumcision, then like, is it really that much better or worse than female circumcision? I mean, I don't think we should allow any of it, but do you think that's true? Like in terms of morality, do you think that these are on the same playing field?
So morally, they both involve cutting body parts off of a non-consenting minor.
Right.
And legally, the issue is increasingly probably going to be treated the same. One of the things that people have talked about is that the laws against female genital cutting in the United States might be unconstitutional because we have an equal protection clause that says, well, you can't make a law that preferences one particular group of people or one gender. And in fact, recently, the federal law that we talk about in the documentary prohibiting female genital cutting at the national level was overturned. So they had the first prosecution of that. I think it was in 2018. I might be getting the date wrong, but there was a case that was thrown out. And the defense was prepared to make the argument that, male circumcision is far more invasive than the ritual nick circumcision of a little girl that was done in Minnesota. And they said, you can't, like, this is not a constitutional law. And the case ended up getting thrown out before going to trial on basically a technicality. They said, well, this is a federal law and the federal government actually is only allowed to regulate interstate commerce. And so, most laws against things like rape or murder or assault are at the state level. And so this should be a state level thing, which means that basically every state has to pass a law against female genital cutting. Now there's no national law against it. And, they've kind of pushed the issue further down the line. But those state laws are going to get challenged on the same grounds because states also can't make unconstitutional laws. Right. And the moral and ethical arguments are very much the same. And, in the Minnesota case, Alan Dershowitz, the famous Jewish lawyer, was prepared to argue for the defense. He was consulting for them. And in that case, I think there's a lot of people who want male genital cutting to continue and are basically willing to repeal the protections for women in order to do that. And you were asking about why it is people come up with these sort of strange arguments and haven't questioned it. And I think the challenge of cultural assumptions is that they are unexamined. So when you're a little kid, people tell you things and you just sort of go with it. Well, that's what we do here, I guess. And it's not until later that those assumptions might be looked at. And so you might have a cultural assumption that consent matters, or that people should be allowed to make their own choices about their bodies. But then you've also been given an assumption that, this particular body modification is somehow different or okay or perfectly normal. And it's not until those two are brought into the conscious mind together that people start to go, wait, like these don't actually fit. And the difficulty is that those two have to be both brought up as something that you question, and doing that might mean confronting psychological truths that your ego doesn't want to deal with. And so, the challenges there are not always just the logical explanation or argument. It's the fact that most people don't make their decisions based on logic. There's a whole host of other identity factors that come into play.
That's true. And then the reliance on doctors. Like we have this godlike worship for doctors in the medical community. And so in the 80s, when a lot of my friends were born, it was just you circumcised your kid because it's cleaner. They have a lower chance for STDs. All of these are horseshit arguments. And because it's going to decrease your risk of penile cancer, which is a rare cancer basically only seen in elderly patients. And this was just the general belief, and everyone did it. Everyone did it. And so I really feel for mothers, especially mothers that had children in the 80s that circumcised their kids, and they're now seeing like the damage they've done, because we trust doctors, and to some degree we should. But I think we've gone so far as a society that we're no longer examining our individual principles, and we're just kind of allowing them to take over and make all sorts of medical decisions for us and for the culture.
Yeah, there's a very strong authority frame with doctors. And authority is one of the most powerful weapons of influence there is. And that's changed in recent years, because I think people are starting to realize that the medical community and the healthcare industry have their own interests, and those interests are not always aligned to the patient. So they will argue for certain things which decrease their liability and increase their profit, and that may not always be what's best for you. I mean, even on larger birth issues, home birth is statistically one of the safest ways to give birth, but it's also not the most expensive way to give birth. So
Right.
That's very true. I think with regard to the medical community, one of the more compelling points that was made in the documentary was how the medical community has changed their perspective on the purpose of circumcision. There was a point that you made in the documentary about how, a couple hundred years ago, it was explicitly stated that this was something which could help prevent people or prevent boys from masturbating too much. And there was all of this kind of pseudoscience around masturbation that was used to prop up the validity of the procedure. And then as soon as the sexual revolution happened, all of that kind of just got swept under the rug and forgotten about. What's your perspective on how we can just be so ignorant to our own history and to the history of this procedure?
Well, the joke is that circumcision is a cure in search of a disease. Meaning, well, we were doing this. We don't really know why we're doing it, but there's got to be a reason why we're doing it. So now people, that's sort of the nature of human psychology, is we look for confirming evidence rather than evidence that might question our assumptions. So it's like, well, why are we doing it? I guess we're doing it for this reason or that reason. Yes, initially it began as a medical practice during the Victorian era as a cure for masturbation. And at the time, there was this idea that sexuality was somehow unhealthy or dirty or dangerous. And many of the hygienic arguments actually go all the way back to this idea that sexuality is somehow dirty. So if you think about people calling, well, it's cleaner, are sexual body parts somehow naturally dirty or wrong? I mean, that goes back to this Victorian idea that, well, from their perspective, they are. Like, there is something dirty about sexuality and negative about it. And yeah, over the years, it's changed completely. And interestingly, the health benefits argument, even that has changed. So the last policy statement put out by the American Academy of Pediatrics said that the health benefits were not enough to recommend it. And then a later paper by one of their policy statements authors said, we're not just evaluating the medical claims, we're also evaluating the cultural benefits, meaning that we don't want to offend certain cultural groups that want this particular procedure to be done. And parents have a whole list of non-medical reasons for which they want it done, and they should be allowed to do that. So the argument has changed from, well, there's this medical thing to now, well, there's this cultural thing, but the cultural thing is the result of the medical thing being pushed through all of the media and academic literature for nearly, for several decades. So it's changed over the years, and you'll find that when you talk to someone about this issue, because there's that underlying psychological thing, they'll give contradictory arguments. So they'll say, oh, well, it's healthier in some way, and then the next minute they'll say, well, we want to do it for some sort of preference reason. And it's like, these are two completely different tracks. It's purely medical, and then it's cultural and religious, and it sort of changes depending on what particular piece of psychology is being defended.
Right. And I also found it very interesting how there seemed to be a development towards circumcision becoming a more extensive procedure when you compare it to the way that it's described biblically. Would you mind just discussing that just a little bit for our viewers?
So the original version of circumcision practiced in the Old Testament or in the Torah or in the original Abrahamic covenant is different than the type of circumcision practiced in American hospitals today. So the original version involved removing the tip of the foreskin, what's known as the ridge band, and not all of the covering of the head of the penis, because the foreskin when a child is born is actually fused to the head of the penis, the same way your fingernail is fused to your finger. So the first step in a hospital circumcision or a medical circumcision or even modern religious circumcision is to break away that connection. Similar, they literally insert a blunt probe. It's the forcible penetration of a minor, which, by the way, in most states is the legal definition of rape. And they will separate those two structures so that they can then pull the foreskin forward and remove all of it. So the original version just, if this is the head of the penis, it just removed the part above it, and now it removes all of it. And that changed during the Hellenistic period when there were Jewish men who wanted to participate in Roman athletic games. And those games were done in the nude. And so they didn't want to look like they weren't Roman, and they would pull that remaining skin forward to cover the head of the penis so it would look like a normal Roman man would. And the rabbis didn't like that, and they wanted, because the purpose of circumcision to them was to denote them as somehow different from Roman culture. So they then changed the circumcision procedure in that period to remove all of the tissue, to be much more invasive. And that version was the version that Victorian doctors then turned into medicalized circumcision. So there's been an evolution over time. And when people say, oh, well, it's in the Bible. First, it's not in the version that we practice now. It's actually very different. And second, part of what separates Christianity as being different from Judaism is that Christians do not have to circumcise. So in Christianity, Christ is seen as the ultimate blood sacrifice. He died for everyone's sins. And so you don't have to do any more blood sacrifices. And a Christian making the argument, well, we should circumcise because it's in the Bible, is a bit like saying, well, we should do animal sacrifices because that's in the Bible. It's not something that actually makes any theological sense. And it's one of those sort of unexamined cultural assumptions. It's really an American cultural assumption, not even a religious cultural assumption.
I get that all the time from audience members that call in and they say, like, how can you say that you're Catholic and you're against circumcision when
Catholic is really against it.
Yeah, I mean, the bishops have come out repeatedly and talked about how there are multiple biblical references that are just blatantly anti-circumcision. And I think I saw this in your documentary, but there was a woman that said who had circumcised her sons, and she said she's vehemently anti-circumcision. But she's like, if you're Christian, there are 120 biblical references saying that that circumcision does bodily harm. You shouldn't do it. And so I think that this is a really anti-Christian thing. So if you could talk a little bit about how it came to be understood that this was a Christian practice. I find that transition really baffling. I'm like, how did we even start to think that this was Christian?
So I think it became an American cultural practice, and Christianity at the time it began was such a part of American culture that the two melded in a certain way. And in that sort of looking for a reason to do it, it's like, well, it's in the Bible, so I guess that must, it's like sort of, there's just sort of an assumption there of some kind. And at the time it began in the Victorian era, it was a cure for, sexual immorality. So I think there was a bit of crossover there where some of the ideas that doctors had at the time were very sort of sex negative, and that was dirty and wrong. And there are strains of Christianity that share that belief. So it's like, well, those two kind of go together, that there's something morally wrong about certain types of sexuality in the Bible, and there's something morally wrong or from their perspective, there's also, well, it makes sense that the medicine would fit that too, essentially. And, culture is weird in how things carry over. I mean, when we sneeze, we say, bless you. but that started during the Middle Ages because people would sneeze when they started to get sick from the Black Plague, and then you would bless them because you didn't want them to get the plague. Yet we still do that today, right? I don't think most people would think that their friends are at risk for getting the Black Plague and that they need to be cured with a Catholic blessing, that's the treatment. But like those cultural traditions, they get in people's psychology and they get in the culture, and unless they're examined, they just continue indefinitely.
Yeah.
And I think that a lot of the attitudes our culture has about circumcision are that sort of indefinite carrying of unexamined beliefs.
Yeah, definitely. I guess I'll play devil's advocate a little bit, but do you believe there are any legitimate reasons for infant male circumcision?
So I am certain that you could construct a case where like there is some scenario where it would be necessary, but you really have to construct a case. You know, you're getting into like weird hypotheticals when you get into that. The scenario where it does make sense to me is if there's an adult making an informed choice about their body.
Right.
And even there are even cases I've heard about where someone does that as an adult as a part of an initiation ceremony of some kind in their particular tribe or culture. And I understand why someone might put themselves through a painful experience to bond with a group. It's sort of the same psychology that hazing rituals follow in fraternities. Like there's this intense pain that you go through as a sort of price of membership to an organization. And I don't think that's a healthy way of relating, but I understand why someone would do it. So, and it also from, if they're an adult, that's their choice, right? If they want to go through that, then it's up to them. But when it comes to children, I don't know that there is any reason to put a child through unnecessary pain that they didn't agree to.
Yeah, I would definitely agree.
Yeah, I so do I.
When you mentioned there about informed consent, this is something that, as someone who is about to have a little boy, and I am actually going to have a home birth, informed consent is something that is really important to me. I want to make sure that I know within like a great degree of certainty that the choices that I'm making for myself and my child are what's best. And I feel like a lot of moms out there, the option to practice informed consent with circumcision isn't really there because there's not only so much conflicting information within the medical community, but there is this kind of pressuring that happens, after labor has happened. Sometimes I've heard stories of women, even hours after giving birth, still kind of under the influence of drugs, being pressured into these procedures. So, How would you say that the informed consent of mothers and parents are being taken away from them, and what can we do as parents to sort of spread the information about what the right decision is for us and our children?
So there's virtually no informed consent on this issue.
Yeah.
Informed consent is a medical ethical idea that you should give before doing a procedure on someone. You should give them whatever information a reasonable person would expect to know. So if you were getting like shoulder surgery, your doctor would sit down with you and say, well, this is what we're hoping to solve, and these are the risks, and these are the ways it might go wrong, and here's the likely outcomes, and what you would expect to know. With circumcision, very often what I hear from people who've gone through the hospital system is that they just ask, would you like your child circumcised? And that's it. There's none of the information that the experts in my film talk about. There's not even a lot of thought put into it. I mean, if you were to get any other lifelong surgical procedure or limb amputation as an adult, you would have a lot of information given on it. And the information that they will give is basically, if they give any at all, is an elevator pitch right in the hospital, right when that parent has just given birth, and like they might still be under the influence of drugs from the birth process, and even if they aren't, there's that psychological like, oh my god, I'm a parent, and there's this new person in my reality, and all the emotions that come up with that. And it's not a, even if there were no drugs in the pregnancy, you're not exactly in a normal, sober, logical, psychological state.
Absolutely.
You're in a new parent state, right?
Yes.
So there's very little informed consent given, and often they're not asked in the pregnancy or in the lead up, right? And so that doesn't make sense from an informed perspective, but it also doesn't make sense from a consent perspective, because the person who should be asked for a procedure is the person the procedure is going to be done on. Yeah. So in the hospital system, they see the mom as their patient, their customer, really.
Yes.
And that the child is just an extension of that they're working on, not a person who might have their own beliefs and feelings that show up later on in life. So virtually everything they do doesn't make sense from an informed or a consent perspective, but it does make sense from a sales perspective, because if you have your customer there and they're not allowed to leave, then you should try to upsell them everything that you can. And circumcision is a relatively easy upsell. Mm-hmm. So yes. I've heard of cases where parents are asked like 6 to 8 times, do you want your child circumcised? And they'll say like, no, we already told you no, stop trying to sell us on it. And it's not until the parent becomes like visibly angry and is yelling at the doctor that they're like, oh, okay, we'll stop trying to sell you, right? But it follows the pattern of high pressure sales tactics much more than what you would expect from informed consent.
Yes, and people aren't really informed of the potential dangers. I think, before I watched your documentary, even though I was against circumcision, I wasn't fully aware of how common the negative repercussions of this procedure can be. I was absolutely in bits when I was listening to some of the mothers' regret stories and what had happened to their boys as a result of going through with this procedure, caving to pressure without fully knowing the whole picture. Mm-hmm. Would you mind talking a little bit about the frequency of botched circumcision and what some of the negative repercussions with regard to the procedure are?
Yeah, botched circumcisions are not something that most parents or even most people think about. And it's one of the things that when you talk to people about this issue, especially people who are in favor, they will completely ignore that topic and pretend like it doesn't exist. But they are surprisingly common. It was actually the Virginia Pediatric Urological Association. One of the things that he told me and has said in an interview is that about 1 in 10 boys who come through his practice have a botch of some kind. And it's not something people think about because most people don't even think about circumcision as surgery, but it has all the risks of any other surgery. And surgical complications are fairly common, especially when you're operating on something that small, and especially when the person doing it has never had to look at the follow-up. So very often in hospitals, circumcision is something performed by medical students and residents and interns. They will use this to train the least experienced person in the hospital in how to do surgery. And if you were having surgery done on yourself, you'd ask like, well, how qualified is the person doing this? And, what are the risks and all those things? But people see circumcision as like an item on the menu when they're in the hospital. And they don't think about like, what device are you using to do this? And keep in mind that 2 out of the 3 most popular devices used of them, one of them has been sued out of business for surgical complications and a high botch rate, and the other has a high complication rate but hasn't yet had that lawsuit. So there are all sorts of risks involved, and people don't think about those. And botches can take a lot of different forms. So there are cases where a child dies from the procedure; they bleed out during it. There's cases where their lungs burst because they're screaming so loud. People have this sort of abstract idea of it, but when you actually look at the procedure, what do you think would happen if you're holding the child down and cutting off part of its body? And then of course there are things that don't show up till later in life, like a skin graft, or like maybe that part of the body just bends too much to one side because more skin was taken off on one side than the other. And by the way, doctors will say that bend is normal, but among intact men, it doesn't seem to occur at the same rate of people who've had botched circumcision. So,
right. There was even a story, I think, in the segment regarding the restoration movement where a man, he told of one of his he had invented this device to help with the restoration process. And he heard of a man who was basically infertile. until after going through the restoration process and then was able to have a child. So, I mean, infertility can even be an aspect of this down the line.
Yeah, there's a variety of outcome, and that's partially because, it's not like men are born with a dotted line that says cut here, right?
Yep.
So some people have all of the inner foreskin removed, and some people only have some, and some people have the frenulum still there, and some don't. And so, when men say that they're fine or okay with it, I mean, maybe it depends on how much was taken, right? There are some people who've had virtually all of the nerve endings of that part of the body removed.
Right.
But it's completely arbitrary how much is taken because there's no medical need to take any of it.
Right. And what you don't, I've heard the same argument from people that are born blind. It's like, well, what do you, like, how do you live? And they're like, I've never known any other way that I could be. So I'm not missing anything. And I hear this argument from circumcised men all the time. Like, you're irrelevant because something was taken from you and you don't know the depths of what you're missing. I did have a question about the incentive in the medical community. Do you think it's primarily financial, or maybe perhaps I've gone too deep into this anti-feminist realm? But while I was watching the documentary, and this hadn't really occurred to me, I was like, is this the earliest expression of this cultural manifestation of toxic masculinity? Like, are we doing this as a punitive measure to inhibit the full extent of male sexuality? And this is like the first thing that we do. Do you think that there's an element of that, or do you think that it is primarily a financial, like a sales tactic?
I think it varies person to person what the motivation is. So from a systemic perspective, it seems like the biggest motivations of the healthcare industry and the medical industry are money and liability. So they do make money on it. It is a significant amount of money. It's over $1 billion a year industry. And at the same time, if they were to say that this procedure is wrong or was unnecessary or was not something that they should have been doing, then every man who they've done the procedure on might have a lawsuit. And the medical liability of that is huge. Yeah. And a lot of what hospitals and medical institutions do is driven by liability and the desire to not get sued, basically. So I think that's a big factor. And I don't know how much of people's motivations are driven by any kind of conscious animosity towards men, but there is definitely a lack of concern for men and men's feelings and men's experience of pain. So I think there's a cultural idea that men are disposable and that pain that men experience is acceptable and okay, and that women are somehow more in need of protection and safety. And that even extends to childhood and infants. And one of the things you'll see from parents who post about their child's circumcision on social media is they'll say, oh, he took it like a man. Like he was a real strong champ. And it's like, that's a baby, like I, as an adult man, would struggle to go through an experience where someone was cutting that part of my body. And expecting a newborn infant to do it is insane. That child is not at an age where they can conceptualize the pain or understand it or even form a narrative about it. All they know is that mom let this happen to me. And that that every person is going to internalize that in a different way. There might be psychological questions that arise in child, like, did I deserve this? Did mom do this on purpose? Can my family not protect me? And it's happening during a stage where that child is developing their earliest ideas about the world. So people have this idea that infants don't remember, but your mind is constantly growing then. Like you're constantly learning about the world. Those connections and neurons are being formed in the brain. And whatever experiences you do at that early age, you might not have a narrative memory of, but it has imprinted in some way. Just like, children who aren't held sometimes suddenly die, and children shortly after that are doing things like learning to walk. Like this is when those connections are being formed. So I think that there is a insensitivity to men's pain and to the pain of especially young men. that is present in this, or at least a lack of concern for it.
Right. Right. I mean, I know a lot of parents that have circumcised their children, but they're like, I would never spank my child. I would never do something like that. And I'm like, in the grand scheme of, non-consensual violence against a child, like, which one do you think is worse?
Right.
And so it's just amazing to me that this has permeated the culture so deeply and become so normalized, despite being such an intrusive and barbaric procedure. And just the genesis of how that's happened. I don't know. I mean, we really have to walk it back as a society, but I'm happy to hear that 50% of men are circumcised, because that is a drastic improvement over the previous generation.
Yeah.
Yeah, it's definitely changing. I think it's changing a lot because of people's access to information. Mm-hmm. So it used to be, if you wanted to learn about this word, you go, well, you go to your doctor. If you were a really high resource person, you might go to the library and read a book on it.
I know, right?
And now we have access to all the information you'd ever want,
Mm-hmm.
So there's a lot more out there.
Yeah. Yeah. I'd like to think that I'm really knowledgeable about the topic of circumcision, but when I was watching your documentary, I knew nothing of the whole element of forced retraction and what that does to a baby. And then I talked to some people about it when I was on vacation this week, and some of them that are in the medical community were like, I have literally never heard of this. And that is horrifying in its own way, because it's also not consensual, and it's done on an infant and does have potentially lifelong repercussions. So if you could talk a little bit about what forced retraction is, why they do it, about only clean what is seen.
Yeah, I'm glad you brought that up, because if you're having a boy and you want to leave him intact, it's important to know about, because they have done surveys. One by Intact America put, I think it was 60% of parents of intact children have had a doctor try to forcibly retract them. So it's a more common than not experience. So like I mentioned, the foreskin is fused to the head of the glands, like your fingernail is fused to your finger. And over time that changes, right? So over time that part of the body becomes mobile, and it's something that moves during sex. And when the child's born, that function isn't needed, so it's attached, and over time that just changes naturally. And very often doesn't change until when the child is older, or even puberty, because if you're a little 4-year-old, you don't necessarily need to have that moving in that way. But doctors who are not informed about the care of intact children don't know that. So their assumption is that there's something dirty or unclean about the foreskin, and that it needs to be cleaned. And they will try to pull it back to clean underneath it. And that would be a bit like if you were to try to pull your fingernail off to clean underneath it. You don't, when you wash your hands, you don't clean, you don't take your fingernails off. You just clean the surface of your hands. Similarly, with intact children, you only clean what is seen. So you don't need to pull parts of them off to try to clean underneath them. You just clean whatever's visible on the outside. But doctors who don't know this will sometimes pull that part of the body back and do what's known as forced retraction, which is where the foreskin is ripped off, which will cause that part of the body to have scar tissue and can lead to infections and scarring and things like that. And of course, if they do this medical error, this form of malpractice, and it leads to an infection, they'll say, well, that's just because the foreskin's so dirty. And that's why we perform circumcision, clearly. Not taking ownership of their malpractice, because of course that would lead to liability. So I actually have heard a lot of people suggest that part of the reason people see the foreskin as infection prone is because doctors are so uninformed about how to take care of it that forced retraction is the norm. Mm-hmm. And I've heard that from people who grew up during a time period when circumcision was the norm, who were still intact. They said forced retraction would happen basically every time they went to the doctor. So, wow. Yeah, I mean, but again, the solution is so simple. Just don't rip that part of the body back. You don't need to do anything. Intact care is actually far easier. You just don't do anything,
Yeah. I think there was a great part of the documentary that talked, it was a gentleman doing a PowerPoint presentation. He was talking about how statistics regarding hygiene and the spread of disease as a result of the foreskin being intact are very misleading. And the way that statistics are often used to support these arguments in favor of circumcision, but when you actually do a little bit of even just basic analysis of these studies that are conducted on, very small portions of the population, you can see that it all sort of falls apart.
Right. Relative risk, I think he was talking about.
Yes, exactly. Would you mind talking just a little bit about that as well?
So there's a statistics trick where you can use relative risk or absolute risk. So the relative risk of being hit by a meteor falling from the sky is probably very low. But if you were standing outside and you went inside, your relative risk of being hit by a meteor has suddenly decreased dramatically because now you have a roof over your head. But the absolute risk of that happening is basically nothing. And so if someone said, well, I'm staying inside all day so I don't get hit by a meteor, you'd think they were a crazy person, right? Similarly, people will use, especially in the case of the claims about circumcision reducing HIV, they will use the relative risk of a few studies to suggest that it reduces the rate of HIV transmission by 60 or 50 or 70%, when the absolute risk is like 1 point something percent, right? And by the way, those studies were conducted in Africa.
Yeah.
Completely different.
I think it was
scenario for getting HIV than the
1.6% risk of contraction if you're circumcised, and then 3 point something. So they were saying it increases your risk by 3 times or 300%. Right. But in actuality, if you're not engaging in unprotected, promiscuous anal sex and you're not an IV drug user and you're living in America, like, you are not going to contract HIV. Right. So I don't know why it matters. And then they talk a lot about HPV, which, irrespective of whether or not it's true, it's generally a transient, benign thing that's common in almost all sexually active people, and there's a vaccine for. So it's like, why are we doing this to young boys to prevent this? Why are we
right? And all of these are the most invasive way to prevent something. So you wouldn't cut off your nose to prevent nose infections, right? You wouldn't cut off your ear to prevent ear infections. Like, you might be able to decrease the risk of ear infections dramatically by not having ears, but that would be a really invasive way to do it. So similarly, like, it may even be true that there are some things you could reduce by removing part of your body. You could probably reduce the spread of sexually transmitted diseases to 0 by removing all of your genitals and looking like a Ken doll. But that would be a really drastic thing to do, and I think most people would prefer to have them. Mm-hmm. So the framing of these is always really strange, because we don't look at any other body part that way. We don't look at, like, well, could we reduce, breast cancer by removing little girls' breasts when they're born, like that? And again, like, when you start talking about other parts of the body that way, it sounds really weird. But because there's this sort of cultural trance around circumcision, people, it takes them a little bit sometimes to realize, oh, like, this is also strange.
I found it so shocking as well when urinary tract infections was used as one of these examples, because obviously women are more prone to having UTIs than men. And when they do, which is actually very, very common, a day of antibiotics is normally all it takes, right, to sort it out. Yeah. But it's also being used as an argument for this, very dangerous, irreversible, potentially life-damaging procedure on infant boys. It's the cognitive dissonance there is just really astounding to me.
It is. I sometimes jokingly refer to all these arguments as like the argument that your penis is trying to kill you, so you have to kill it first. Like, if you don't cut this part of the body off, like, something's going to happen. It's just going to kill you. And it's like a very strange relationship to that part of the body, Yeah. But yeah, I mean, again, like, a lot of these tactics are based in fear. It's like the idea that, well, if you don't do something, you're a bad parent and this thing's going to happen to you. And they're sales tactics. They're things that people use to. And now, by the way, if you talk to even doctors who perform circumcisions or are in favor of the procedure and inform that, they'll say, like, a lot of that stuff isn't true, that we just do it for cultural reasons, basically. Wow. Now, from their perspective, the cultural reasons are perfectly acceptable. They're often not informed about the harm, but that's usually what it comes down to. I don't think most parents are really deeply reading the academic literature on various disease transmissions. They're doing what for other psychological reasons seems right to them.
Right.
Yes.
That's definitely true. Well, we've taken up like 50 minutes of your time. If there's anything else you want to talk about in the documentary that you think that we might have missed, that you think is important knowledge for the public, I think now would probably be a good time. But otherwise, if you want to tell the audience where they can find your documentary, where they can watch it, how they can pay for it, that'd be great.
Yeah, so there's always more that I could say on this issue. It's one of those things that affects every part of a person's life. It affects psychology and law, and we can go down a million different rabbit holes on it. But if you want to learn more, circumcisionmovie.com is where you can get a copy of the film. And it's on Amazon and Vimeo and iTunes and all those various places. And I am on all the social media as well at BD Marotta on Twitter, Facebook, Instagram, all those places. I'm going to be putting out a lot more material this year on how people can create change around the issue. So if you are someone who feels moved by this topic and wants to do something to not just protect your own kids and help make the best decision for them, but also help create change for others, then follow me there, and I'll be providing lots of ways to do that.
Great.
Excellent.
Thank you so
all
much
those
for
links
joining
will
us.
be in
all links will be
all links mentioned will be in the description there, guys.
Cool.
All right. Well, thank you so much for joining us. We're way better at the introduction because we talk about who's going to do it. I'm sorry. We're just talking over each other. Yeah, but as we said, everything will be in the description below, how you can get involved, his social media links, how you can watch the documentary. It's excellent. I highly suggest you watch it, even though it's difficult content. It's really necessary. And then we are in this movement where a lot of people are having babies. And so I think it's definitely important to spread the word. Right now, it's all we can do to prevent from repeating our parents' mistakes, right? So thank you so much for joining us, Brendon, and we will see you soon.
Thank you.
Bye, guys.
Okay, bye, guys.